This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
We should not interfere with botanical diversity. The latter provides ethnomedicine and wild foods integral to sustaining public health. Human beings also require clean water and air. When the natural biodiversity is distorted through environmental pollution, access to clean water and high-quality air is hampered. As a result, air and waterborne diseases are highly likely to be major concerns for public health. For instance, a number of communicable diseases can be transmitted from one individual to another when the surrounding air is contaminated. Examples include tuberculosis and influenza. Hence, poor environmental conservation directly impacts public health. The botanical ethnomedicine values have been calculated from the article. The Madagascar rainforest was used to gather the required information for the above calculation. The findings indicate that the local population has massively benefited from the botanical ethnomedicines provided by the botanical diversity. Several novel pharmaceutical drugs are also obtained from the local biodiversity. The findings also indicate that 241 local species are utilized as ethnomedicines, while agricultural wheat species number about 113. The study provides adequate evidence of ethnomedicine's incredible contribution to public health. The research study has also recommended the conservation of tropical forests so that the broad diversity of natural plant species can benefit public health management. Sustainable use of biodiversity across the globe can significantly assist in reducing public health challenges in modern society. It is necessary to explore the relationship between environmental conservation and public health. Our environment cannot be conserved if we continue to pollute it at every opportunity. One of the common human activities related to environmental degradation is deforestation. Natural herbs and ethnomedicines cannot be obtained in deforested locations. Public health largely depends on the admission of effective drugs to diseased individuals, but this process may not be possible if the environment is degraded. Second, the emission of greenhouse gases such as carbon dioxide and methane often leads to intense carbon sequestration and subsequent global warming and climate change. Any form of variation in the natural ecosystem tends to interfere with regional and global climatic patterns. Recent research studies on climate change indicate that warmer environmental conditions increase the morbidity level of certain diseases. For example, malaria has become more prevalent in high-altitude regions, contrary to the past few decades. This implies that public health has been negatively impacted by the disruption of the natural ecosystem. Unless the environment is conserved, the human population will continue to experience increased episodes of ill health. Seasonal influenza and several forms of respiratory infections are also triggered by poor conservation of the environment. It is equally unfortunate to mention that climate change has led to erratic weather conditions across the globe. There are regions that experience extreme weather patterns, such as intense drought or excessive flooding events. Such weather patterns have remarkably interfered with crop and animal production. As a consequence, vital food nutrients are no longer available for human consumption. Worse still, some regions in the third world countries have suffered from gross malnutrition and overall poor state of health. Due to mismanagement of the immediate environment, most low-income economies are now seeking ways to address public health challenges occasioned by malnutrition. If you want to find more works like this essay on importance of environmental conservation for public health, head over to ivypanda.com. It has a collection of samples with thousands of submissions covering virtually all academic subjects.